My role is a research nurse for the Institute of Metabolic Science for the university, and I also work as a specialist nurse in an NHS paediatric clinic, and then I worked here at Addenbrooke's Hospital in Cambridge as a nurse on the Children's Intensive Care Unit for 15 years. When I was thinking of retraining as a teacher, a colleague of mine spoke to me about the research she was doing with a group looking at the use of technology in children with type 1 diabetes. And this sounded really fascinating and rewarding, so I decided to work for them for a short while. The research area that I work in is severe insulin resistance, and that's looking at people with rare metabolic problems. And we're looking at people with insulin resistance. That's children, adolescents, adults. And then that research is done here, and then we also take that into the clinic environment at this hospital. I feel that my research experience has improved my clinical practice because I'm now able to explain to the patients in my clinic the reason that we are doing complex tests and what these mean for the patient. If I didn't have the research background, I wouldn't be able to do the NHS role. I'm the only specialist nurse in the whole country for this clinic. I'm able to use all my clinical skills when I'm looking after my research patients, and I develop protocols for their study visit. I can take all their blood samples, take their biopsies, take informed consent because I have the research training to do so, and I can explain complex genetic possible diagnoses to them. I understand how to run a research study and the regulations around that, and obviously I have good clinical practice training, which is really essential for research. And when I'm designing protocols or patient information leaflets, I understand what the patient in the clinic needs from that information. So I'm able to use the language that I know the ethics committees would require, but also the patients can understand the information that they're receiving. We recently had a family with a rare unknown genetic diagnosis, and we were hoping to find the diagnosis for them. So we worked together with the local team and the team here in the labs, the NHS, the geneticists and the family, and we found a diagnosis. And my role within that was to be the link between all of those professionals and the family, and to be available to explain the diagnosis.